It's common, especially after October 7th. October 7th, there were many, not a small number of terrorists that were arrested and captured, and they had medical issues. They were building a makeshift bomb, and the bomb exploded in their hands, and so they had all sorts of different injuries to their hands. There is a wide spectrum of medical problems that terrorists and people from different jails can come to the emergency department to seek care. And the answer, one of my sons, when he was in high school, they had a Shabbat for the parents, and so they asked me to talk about the issue over the Shabbat, and I said,
hello everyone, we have a very exciting guest today, Dr. Todd Zalut. Dr. Todd Zalut is a pioneering emergency medicine specialist who served as Israel's first residency-trained physician in the field and has led the Department of Emergency Medicine at Shaare Zedek Medical Center since 2003. His extensive background in public service includes 17 years of reserve duty in an airborne rescue unit, service on the medical team for the President's Office, otherwise known as the Beit Hanassi, and a deployment to the field hospital on the Syrian border. A dedicated architect of community-based care, he developed the Hatzal system in Gush Etzion and continues to advocate for medical accessibility through the development of affordable, critical, and essential life-saving emergency equipment. We hope you enjoyed the conversation today. Okay. Dr. Zalut, thank you so much for being with us here today.
My pleasure. Thank you for inviting me.
It's very exciting for me. I feel like there's a lot that we can all learn from you.
Thank you. Thank you. I'm not sure, but we'll see.
We'll find out right now.
Okay.
The first thing I wanted to talk to you about is, I think it's true in any generation, but especially this one, stress is something that we don't deal with well. I don't think humans ever have, but now we have tons of escapes. We have Netflix, we have video games, we have TikToks and YouTube and whatever people are super interested in these days. We're really good at running away from issues. As someone who is the doctor that manages all the other doctors in the ER, so you're going to know stress management, I think, better than anyone else. So what is it like working in such a high-stress environment, and what do you do to cope?
So first I have to give you a little background. My training is in emergency medicine. Mm-hmm. That is what I trained in when I finished my medical school training, and that's what I've done for the last 40 years. So that's what I know. That's what I do every day, almost every day. And so for me, I have different kinds of stresses. For me, I get a lot less stressed when I'm taking care of a patient who's critically ill or I'm resuscitating them, because I do it so often, and because
you're less stressed. So you're resuscitating someone and you're okay.
I'm less stressed. And in parentheses, I would just say that part of what makes Shaare Zedek different from other hospitals and the emergency department at Shaare Zedek is I put a big emphasis on the fact that my residents and my young doctors have to spend a lot of time in the ICU setting, in the cardiac care setting, so they know how to take care of critically ill patients. I say to them time after time after time, I want you to be able to take care of these patients without your pulse getting up, without your blood pressure rising. What makes me nervous is having to talk in front of cameras and having to talk in front of people. I get a lot less nervous when I'm taking care of patients and even critical care patients. Frequently, even in the field where my resources are a lot more limited, that can make me a little bit more stressed, but my family gets a big kick out of the fact that I get stressed over different kinds of things. And that's really the bottom line, is that people get stressed over different kinds of things, and you have to learn how to deal with it because it's part of life. It's not just part of life here living in Israel, which is very stressful from the get-go, but it's also part of life wherever you are. There's going to be stresses. There's stresses in interpersonal relationships. There's financial stresses. There's social stresses. There's work stresses. There's all sorts of different kinds of stresses in life, and people have to deal with them. And everybody finds their own way. Many people find it through hobbies. Many people find it through exercise. Everybody has to find, I don't think there's a one cure fits all for stress. But it's been very interesting to me over the years to understand that people are stressed over different things. And what I find very stressful, my kids laugh at. They think, that's nothing. And what they find very stressful, for me, is less stressful.
So let's actually, I'm just going to break that down into two things that you said. So number one is, for the example that you gave of resuscitating a patient, you don't find that stressful. So I want to talk about that for a second. But also, you also said that there are other things that do stress you out, and then there's going to be your own stress management there. So the first thing I want to talk about is resuscitating someone. How can you not find that stressful? And I don't say that in an accusatory way, but like this is your job. This is something you've been doing for many years, and maybe I should also be asking Dr. Zalut from 40 years ago. But in such a high pressure, high stake moment, why are you calm, or how can you be calm? How have you constructed that philosophically, or whatever it is in your head, that you're at peace at that moment?
Well, first of all, you have to feel comfortable with the medicine. So you have to feel comfortable taking care of patients who are critically ill. You also have to understand what tools you have to better understand why they're critically ill. And once you better understand why they're critically ill, the treatment then follows, because you have plus minus not always the specific diagnosis, but you know the direction that you're going in. For example, a person who is being resuscitated after having a high fever and having a low blood pressure measured in the field, and you know that they probably have overwhelming infection, that goes down path A. The person who is a 50, 60-year-old person with different cardiovascular risk factors was seen clutching his chest and collapses, that goes down pathway B. But pathway A and B are very clearly defined. And they can take you in different directions as the results of the blood tests come back, as a result of the x-rays and the different imaging studies that we can do, the bedside ultrasound, whatever it's going to be. We have a lot of tools at our disposal in order to better understand what's happening to the patient. And once you better understand what's happening to the patient, then the treatment is a clearer path.
Is that because of confidence? Like you know that you're doing the right thing for the patient at that time?
Well, you don't always know that you're doing the right thing.
That would stress me out.
There is something like a gestalt. There is the gestalt, and there is the clinical, the clinical decision-making process. So you don't always know that you're doing the right thing, but you're doing it in a logical sequence. And so you're being presented with a certain picture, and then based upon that picture, you decide A, B, and C. And as you do A, B, and C, you may get results, and it may take you down a different pathway. But that's all part of the process. And you learn after a while that, first of all, it doesn't help to get stressed out, and B, that you have to keep your head about you, and you have to understand what everybody's doing, because you're doing it as a team. And when I'm resuscitating somebody and I'm directing the team, I'm literally directing the team. I'm telling this person to do that. You're so busy and you're so caught up in what it is that you're doing that you don't really have time to think about the fact that it's life and death, and the fact that you're the one that's directing traffic. It's a busy time, and you have a certain number of people that you're directing, and you're telling them what to do, give medicines, do CPR, check this, check that, and you don't really stop and think, well, this person's life is in the balance. It's understood, but it's not really something that comes to the forefront of your consciousness. You're too busy taking care of the patient.
Does that bleed into any other part of your life? Meaning, can you be so busy that you're not going to be stressed out of something else that's going on in your life at the same time?
So, I don't know if you're aware of this, but many people will say that men do not multitask. And I always say that no, doctors in the emergency department, even the male doctors, can in fact multitask. But I think that you do get tied up in things. You can get so tied up in something that you're seeing the tree instead of the forest. But frequently you have people around you that bring you back to reality and bring you back to seeing the whole picture, or seeing the individual tree, whatever you may be missing. Lots of times people will bring you back down to reality and help you to see what it is that you're supposed to be seeing.
But I'm trying to get to why in such what someone else, like myself, would find the most stressful point in perhaps my life, resuscitating a patient. I remember, I have nothing to do with the medical field, but I remember once just witnessing it. I was a teenager, and I was going to the store, and I was picking something up, and there was a woman that fell, and she hit her head, and she coded, and that it was a huge event. But it was like it was traumatic just to watch that thing. Right. So what is it about that situation that is able to get you? I'm just trying to figure it out to be calm.
The difference is that you don't really understand what's happening.
Of course I don't.
And that's the difference. The difference is that you're seeing all of these people do things which may even be painful to the patient, but obviously they're doing it with the intent to try to help the patient. And you don't really understand, and nor does the patient. And frequently there is a problem with that the patient doesn't really understand what it is we're doing and why we're doing it, especially with children. And they start to fight and they start to resist, and that causes a whole different loop of problems. But the difference between what you're describing is that you're not really understanding what's going on and what the paramedics were doing or the doctor was doing or whatever, whoever was working on the lady, and that's the difference. I remember as a medical student, I went to I was a resident. I was a resident, and across the street from the hospital, they had a fair for new cars. Mm-hmm. And I went with one of my attendings, one of my senior doctors, and I was just a junior. I didn't really, and because he was looking for a car, and we went and we saw on the other side of the auditorium a huge crowd. And we thought there must be a great car there. So we went and we ran into a resuscitation, mm-hmm. and the senior doctor said, "Let's help, we're doctors." And then it was like the parting of the Red Sea. Like everybody just split, and we went in and we resuscitated the person. But it's very scary. It's very traumatic for many people. But when you understand what everybody's doing and what role everybody's playing, because they really are assigned specific roles most of the time, then it's much less traumatic.
So then I would say your experience is as follows, and correct me if I'm wrong. That anxiety or stress is having less information on your current environment, which therefore makes the next outcomes extremely unpredictable. So in that situation that I was describing, I was incredibly scared because I didn't understand anything in what was going on around me, and I didn't know what was going to happen next. But versus you, who is a doctor with a lot of years of experience under your belt, you see a situation and you're like, okay, I see the environment, I see all of the variables within the environment, and I know where it's probably going to go. So your confidence level, not necessarily in success or failure, but it's more like, I know what the next scene in this movie is. Is that it?
It's very much, you hit it right on the head. And it's very much like knowing what the next step is going to be. And it could be one of maybe 2 or 3 or 4 or 5 options, depending upon all sorts of different variables. But you know what those 5 options are, and you know that probably you're going to go down one of those 5 paths.
So is the other things that you find in life that are stressful, would you say that those are things that are dominated by variables that you don't know or don't understand?
Exactly. For me, to stand up and to give a shear would be horrific. I'd be scared to death. I would have to take Valium for a week before. But that's because I'm not very good at putting together a shear, taking it from the beginning to the end, and driving home the points that need to be driven home. Right. It's because I have a better understanding, better training, and more experience.
In those situations when you don't know what's going to happen next, is there a method that you use that you find is able to alleviate a lot of that stress, or is it just knowledge?
So a lot of it depends on how fast things are happening. Sometimes you just have to close your eyes, take a couple deep breaths, and plunge ahead. Mm-hmm. Sometimes you don't even have the opportunity to take a couple deep breaths and close your eyes. You have to just plunge ahead. Sometimes you have a couple days before decisions have to be made and before you have to have certain conversations. And so you can think about it more, and you can relax a little bit and go into the hobbies and do your hobbies and try and take your mind off of it, and think a little bit more about other things and other people and things that are maybe more important, maybe less stressful.
And is that what you would teach people that are trying to figure out stress and manage it?
I think hobbies are extremely important. I think people can participate in different endeavors, and I think that helps a lot of people to relax. I think a lot of it depends upon what is causing the specific stress, but I think everybody has to find their own little outlet and their own different way to release stress. Some people find it by running or bicycling. Some people find it by just walking out the door and screaming. But everybody has to find their outlet.
Mm-hmm. And then once they do, the reintroduction of that stress should be like a learning process to alleviate the entire situation in general. So again, you have a little bit more of confidence of maybe where the situation is going to go. Does that make sense?
So when you learn from your experience, then the next time you encounter the problem, you're going to be less stressed because, well, I've been here, done that. You can't always learn from your experiences. We try to, but we don't always learn from them. But certainly that is one long-term method to help deal with stress. Short-term method, I think you have to find other ways.
In the ER setting, have you ever had doctors where they just weren't so great at managing stress and they had to go? They just couldn't learn it?
There's a lot. First of all, in most emergency departments in the Western world, you have doctors who are medical students, you have interns, you have young residents from different specialties that rotate through. So you have a lot of people who are coming and working on any given day. And a lot of people have difficulty with the stress. And at the end of the day, they, most of the time, choose a specialty that's less stressful. And that's good. That's good for them.
Mm-hmm. Okay, so I want to pivot a little bit and talk a little bit about evil. Evil. So my brother, hi Moshe, so he's an ER doctor in Baltimore, and I always found it interesting. I'll say it this way. Everyone wants to ask a doctor in Eretz Yisrael, in Israel, what's it like to take care of a patient who you know is a terrorist, okay, who wants to kill you or harm you? And I think that's a very important question, but I don't think it's a fair question to be just asking doctors in Israel. I think that there are ER doctors in general all over the world, and by the way, psychologists and psychiatrists as well, that you have to treat patients that you know is the aggressor in any particular situation. I think that's a very, very difficult thing to do. As people that aren't caregivers, we have no idea what that's like because we never have that sort of challenge. Right. So what is that like? What's it like helping someone? It doesn't necessarily need to be a terrorist, but inclusive of them as well.
But the terrorist is a good example.
Yeah, it is.
So,
have you had that experience?
Yes. I think any doctor in any emergency department in this country has had that experience, but especially in Jerusalem, because if you look to see what's happened in the state of Israel over the last 75 years, and in Palestine before the creation of the state of Israel, there was not a small amount of terrorism, and when you look on a country-wide level, there have been more incidents in Jerusalem than any other place in the country. So especially doctors in emergency departments in the city of Jerusalem have all had to take care of terrorists.
It's that common?
It's common, especially after October 7th. October 7th, there were many, not a small number of terrorists that were arrested and captured, and they had medical issues. They were building a makeshift bomb, and the bomb exploded in their hands, and so they had all sorts of different injuries to their hands. There is a wide spectrum of medical problems that terrorists and people from different jails can come to the emergency department to seek care. And the answer, one of my sons, when he was in high school, they had a Shabbat for the parents. And so they asked me to talk about the issue over the Shabbat. And I said, not sure how much it really is interesting to people, first of all, but many doctors, not all doctors, took the Hippocratic Oath. And I did not take the Hippocratic Oath. We were not even asked to take the Hippocratic Oath in my medical school. But if you take the Hippocratic Oath, then in theory, you're obligated at some level to take care of anybody who comes across your door. Mm-hmm. On a more logical, down-to-earth level, the logic is based on 2 points. One is that there was an incident in Jerusalem 25 years ago, I want to say, plus minus, during a wave of terror attacks that was the Intifada. And there was a bus that exploded. No, I don't even think it was a bus. I think there was a pigua. I don't remember what the pigua was, but everybody marked a certain person as the terrorist. And so when the paramedics arrived, they were told that person over there is the terrorist. And in fact, he wasn't. He was a Jewish victim, and his care was delayed. Wow. Because everybody thought he was the terrorist, and so they treated him last. And Baruch Hashem, he survived, and he lived in the tale. But that tale is a common answer to the question is, how do you know, like, if you don't know who the terrorist is, or you do know who the terrorist is, and you think you know who the terrorist is, you're not always 100% correct. And the other point is that the Shabak takes these guys and gets information out of them to prevent the next terrorist attack, and to nab the guy who drove him to wherever it is he did the terrorist attack, so that he can't drive somebody else in another week, month, or year. So there's a lot of rationale behind it that if I help this person today and he survives, it could be that the information he gives to the Shabak will help prevent another attack.
Yeah, but he doesn't need his hand or his right leg to do that.
Correct, but if you don't save the hand or you don't save the leg, then he's at risk for infection, and he's at risk for sepsis, and at risk for dying from the complications of that. So you don't always know, again, where it's going to take you. And so you treat the terrorist because at the end of the day, you're hopeful that you'll be able to stop the next terrorist attack.
Has all your years doing that, have you ever asked yourself, should I have done that? Or you never
Especially
go to sleep?
After October 7th, for sure. For sure. We had a lot of debates in the department about it.
What came out of those debates? What were some of the arguments?
Well, the arguments are exactly as you were saying. The nurses and the doctors had husbands, sons, brothers, fathers. Everybody was off in the army, off in Gaza, fighting, and you never knew who was going to come home.
Right.
And we all went through that experience, and to know that you're taking care of a terrorist who an hour ago, yesterday, a week ago, was trying to kill your loved one is very, very challenging. And we had a lot of discussions about it on the level of the head of the hospital and the rabbanim at the hospital. And we have Rabbi Steinberg, who wrote the book on medical halakha and ethics. And he participated in many of the discussions too. And it was a work in progress. And we had many discussions. Just to complicate things, on top of it all, you're taking care of these terrorists, and you have Arab doctors who are there taking care of them. Or you have Arab doctors taking care of the soldiers that came in by helicopter because they were critically injured. It's a very complicated issue. It's a very complicated environment that you're working in. And at the end of the day, you know that the Arab doctors are looking to see how you take care of the terrorists. And you wonder to yourself if that is going to affect the way they take care of the soldier that comes in another hour. There's all sorts of different thought processes behind the whole discussion. And at the end of the day, we realize that you have to take care of people regardless. And we went from a system where 5-6 years ago, we get notices on our telephones when there's a trauma alert. And it used to be that you would get the alert that it was a trauma, and there's different levels to trauma. It was a trauma, and they would write that the terrorist is coming. And we stopped doing that because we saw that the staff responded in a totally different way. It was a totally different environment in the trauma bay. And now it's just somebody in their 20s coming with a gunshot wound or a blast injury, whatever it might be.
Do you think that that's right?
I think it's ethically correct.
So then that's right.
I think it's ethically correct.
Have you ever had to excuse a doctor because you didn't think that they were doing the right job with a patient because of that issue?
No, not at Shaarei Tzedek. No,
wow, that's amazing.
No, I've had to excuse doctors for other issues, but not because of this.
Mm-hmm.
But no, not because of this.
Wow, that's amazing.
Yeah.
Do you think that, let's shift a little bit, because a lot of the argument on the other side is, well, the Shabbat could use them, or et cetera, et cetera. What if it's someone that the Shabbat couldn't use? Let's take terrorists off the table. Let's say a murderer, or I don't know, someone of the like.
Well, so the murderer or has not gone through the system and not been found guilty yet of his crime, or he's gone through the system, he's been found guilty, supposedly, and he's now in prison serving his time and paying his dues to society. So just to give you a little background, my father was a lawyer and a judge in America.
You're a good Jew.
And so I actually wanted to go into law, but he wouldn't let me. But I had this conversation many times with him because he did a lot of public defense work of people who couldn't afford lawyers. And many times he found himself defending people who he knew were guilty of the crime they were being charged with. And I used to ask him all the time, how can you do this? And there were murder cases on the list. Like, how can you defend this person knowing that he committed the crime? He committed murder, and you're trying to get him or totally off or a lighter sentence.
Right.
And he really believed in the system. And he believed that every person was entitled to a good defense, and that was his job, and that's what he was being paid for. And it really wasn't even an ethical issue for him. It was on the level of the system requires this, and so this is what we do. And in some ways, maybe I learned from him, and that's really what I'm doing.
Interesting. Okay, let's pivot a little bit. I can't imagine a more nudnik place in the world to be an ER doctor, because Jews are nudniks.
Nudniks?
Yeah, I'm sure we are. What's it like taking care of predominantly Jewish patients and especially Orthodox ones? Are we especially difficult?
There are a lot of cultural issues that come into play. And having trained in Chicago, I trained primarily in 3 different hospitals, none of which were in the Jewish neighborhoods in Chicago. So predominantly my population was not Jewish. And then coming to Israel and taking care of a predominantly Jewish population. So I would like to answer with two points. I'll give you an example. A person comes in and he has a certain kind of arrhythmia of his heart. His heartbeat, instead of being a normal, orderly heartbeat, it's erratic. And you want to give him medications to try and get his heartbeat back into a regular rhythm, and also to prevent certain complications from the fact that it's now irregular. And he won't take the medicines until he talks to his Rav. And that process of talking to his rabbi can take hours because his Rav doesn't know that he's supposed to be answering the phone. And so Ploni Almoni, Moshe Cohen, calls his Rav. He's in the middle of davening, he's in the middle of a shir. He's not going to answer Ploni Almoni. He doesn't understand that he's in the hospital waiting for his psak to get treatment.
Right.
So it can take hours, and sometimes it's extremely frustrating, especially when you see certain complications happen as a result of the delay. But again, it's part of the culture. One of the things that my wife and kids have a good time laughing at me about is that we're now in Israel, 80% of the population is Jewish, and it's a bell curve, right? The intelligence quotient of the population is a bell curve. And so one of the things that's hardest for me is explaining to a patient over and over and over again what's wrong with them, and they're just not understanding. And I thought at the beginning it was because I just wasn't explaining it well in Hebrew, but my Hebrew is sufficient now. It's not great, but it's sufficient. And I understand now that it's just different people are able to absorb and understand different things. And not everybody can understand the medical issues of what's wrong with them. And so at the end of the day, you just have to say, this is what, you need to take this medicine twice a day, get somebody to help you with the medicine, and follow up with your regular doctor. But it's 2 very interesting cultural issues that happen not infrequently.
Why is that second one a cultural issue? Because Orthodox people in general are less educated?
No, not just Orthodox. No, not related to Orthodoxy. Related just to the Jewish population within the country. Nothing to do with...
But wouldn't that be any population in any country?
Right, but in Chicago, when 90% of the population is not Jewish, it's much easier for me to understand that this person opposite me. But in America, the Yidden are at a certain level. And it was hard. It's still hard for me to understand that not all the Yidden in Israel are at that level.
How do you manage the triage with that? Like, again, you have a patient that needs to speak to his Rav or Rebbitzin first or whatever. Like, how do you manage that in terms of triage? Do you just kick them out of the ER?
No. You don't kick them out. You keep them until they manage to talk to their Rav because they need the treatment. You can talk to them and you can explain to them, this is what I want to do for you. This is why I want to do it. And you can explain to them the medications you want to give them. You can explain to them the tests that you want to do. But many times until he talks to the Rav, and you just have to be patient with him and try very hard to make sure that the world doesn't collapse around him.
Have you ever had patients that refuse treatment on a religious basis?
I would word it a little bit differently with your permission. I wouldn't say refuse. It's not necessarily refusing the treatment that you're offering, it's choosing not to take the treatment. Like you can always offer people different avenues. Corona was a great example. And it has nothing to do necessarily with Frumkeit. It has to do with false information that's being distributed. It had to do with all sorts of different beliefs that people had about conspiracy theories or whatever it might be. But many people chose not to get vaccinated. Many people chose, when they came in and we tested them and they were positive for corona, many people refused to go into the immune biology, we called it, where everybody else there was positive for corona. So that way they weren't infecting other people. And that became a little bit complicated because you couldn't keep them in a regular space because they would infect other people, right. But they were refusing to go in with everybody else. That was a bit of a challenge.
Is there anything specific to Eretz Yisrael that people find it hard to accept certain treatments? I'll give you just an example. I think this is really an assumption. I'm going to make it anyway, okay? But I think that people on the more Kitzuni end of the spectrum might refuse things like vaccines in general, or other sorts of, I think, like basic treatment where medical knowledge is pretty up to date and there's a consensus about what people should and should not be doing.
And it's really painful when you see the child who has polio because his parents didn't vaccinate.
So can you talk about that a little bit, especially for our listeners? Like what are some just basic things that we're just really just ignoring?
So I never saw polio in America. Everybody was vaccinated for polio. We're in the middle of a major measles epidemic in this country because
Is it major measles? It's major.
Major. Children have died. We have people
Here in Yerushalayim?
Yeah. One just recently, a baby just died recently this week. It's hard. It's heartbreaking. It's heartbreaking because the child doesn't make the decision. It's the parents that are making the decision for the child, obviously, and their decision, however they came to that decision, was not to vaccinate the child, and as a result, the child is sick with whatever they may be sick with. I never saw polio in America until I came to Israel. I saw polio. There are just things that we see, not on a daily basis, but much more than you would see in other Western countries. Because people, and again, it's not always even related to Frumkeit. It's frequently just bad decision-making process or different misconceptions or different taboos within their
Why is that
subculture.
prevalent? I'm trying to figure out why is that prevalent here?
There was a study that was published in the early 70s, I want to say, maybe even in the 60s, where the bottom line conclusion of the article was that certain vaccines can cause children to be autistic.
Right.
And that study has been disproven. And in fact, the author of the study later admitted just making it up.
It, yeah.
He just made it up. But that study is still quoted on a regular basis by parents who do not want to vaccinate their children. And yes.
Do you get it? Why?
No.
Like I find that confusing. I never understood that.
I don't understand it. I find myself frequently having to step out of the room and take a couple deep breaths, close my eyes a couple times before I can continue on the conversation or the exam. Because it's so frustrating that these taboos, which are not based on any science, continue because of word of mouth and because of false ideas. I also don't understand it, but I can tell you there are frequently young Western people in this country, people who either were born in the Western world, Anglo world, or grew up in an Anglo family, and they still don't get it.
Okay, give me some common ones where people are just not getting it. So we have vaccines. What else are people just stubbornly and arrogantly dismissing?
Vaccines is the biggie. There's, I don't know, that's the one that comes to mind right now. I'm not thinking of anything else.
What's the way to combat that from the like how do we?
It's education. And it can't necessarily even come from the medical people. It needs to come in the frum world, from the Rabbanim, in the different cultures. It needs to come from the leaders of those cultures. I'm not going to try and identify one specific culture, but it needs to come from the leaders within those cultures. They need to understand that most of the time it's the kids that pay the price, the babies that pay the price for the misinformation and the misideas that they have.
Yeah, the issue is that I think it's dogmatic, meaning as a teenager, I thought it was interesting to watch these debates between, Israel versus Palestine and, these really like hot button topics, but they're really just a waste of time, in my humble opinion, because it's the same conversation over again and neither side is going to agree with each other most of the time.
Not only that, but your chances of convincing the other person
are zero.
Are small.
Exactly.
Are small. But it's a little bit different on the universities now in America because there's so many people that are demonstrating against us and have so many misconceptions, and they really don't understand what's going on. So there is, at some level, the ability to change a few people's minds out there just based on education.
I'm not saying there's no value to it, but I'm just saying, I wouldn't address that sort of debate. Like if I was sitting with, if someone has a halachic discussion and they sit down with me on the table, and I'm going to have a halachic discussion with them, I disagree with their point, I'm very comfortable in spending an hour bashing them to the best I can and then me, not because I'm not coming from a place of you're wrong because I'm right. It's like you have an opinion, I have an opinion, I think my opinion is correct, I'm going to try to convince you, but if you convince me otherwise, I'll hop to your side. Like it's a very honest conversation. I feel that there are certain topics, I just use Israel and Palestine as one of them, but like vaccines, where if you're speaking to, it's rare that you find an anti-vaxxer that says, I'd love to have an open conversation about the topic.
But what would happen if the Rabbanim came out and said, you should vaccinate your kids?
I really don't, honestly, I don't think it'd make a difference. I don't think it'd make much of a difference.
That's interesting.
Yeah.
That's interesting because
I think it's deeper. I'll give you some example. I'll give you some. It's not the first time that I've gotten the question of should I have my kid vaccinated. Okay, when I get a shaila of should I have my kid vaccinated, I know whatever I'm going to say is not going to. I always say yes, of course you should. But I don't remember it once making a difference. I remember there was a woman that asked me because she didn't believe in medicine, and so she said, okay, I'm calling you. She asked me the question. I said, yeah, and then the father called me the next day and said, she thinks that you're really modern. So after she asked you, she's not, could you ask this other rabbi? And I said, no. And the reason why I said no, I said, because it's going to be the same thing. So he said, no, I think it'd make a big difference. He went and he went the level above me and asked that rabbi, and of course it didn't make a difference at all.
So when the second rabbi gave the saktim,
didn't do anything.
No.
And what I'm saying is I think there are, again, like you said, there are certain people that will listen to reason and they are looking for some sort of guidance, but there are some people that it's just dogmatic. There's nothing that you can do to easily sway them. So look, you're a rational person. I like to think I'm a rational person. Here's an example, okay? So once I had a discussion about, when I was a little bit more knowledgeable, not that I'm any medical professional on any level, but about vaccines. So I brought, I think 5 or 6 studies in which I showed that it was really not only healthy to take these vaccines, but a lot of the noise that was going on in the world was really baseless. I was able to easily use Google Scholar for people who want to use it. It's an excellent resource. But in any event, so the other person said, no, all of those from like 5 or 6 different scholarly journals, all of those doctors in these peer-reviewed studies, they're all from people that have agendas. So they're not going to tell you the truth, right? So they're going to actively lie to you. So what evidence am I supposed to bring to the table then? Because whatever I'm going to bring to the table, I'm not a doctor. So if I'm a doctor, you're just going to say that I'm lying. And if I'm not a doctor, I'm going to quote some sort of scientific study. You're going to say that those doctors are not telling the truth. See what I mean in terms of dogmatic?
So then there's no way you can win.
Yeah, I wonder if have you had an experience where you've been able to convince the parent to do something else? I just feel like it's really
But
horrible.
Almost always, if they're from, I almost always send them to a rav.
Do you find that helps?
Sometimes.
Okay.
Sometimes.
I just feel like that success rate should be 99.9%, and I feel like it's 20.
I find a lot of it has to do with the parent's connection with the rav. Like if the parent has a really tight connection with the rav, then the chances of success are much greater. If they go to a rav that they don't really know, they don't really have a kesher with, he's a big, quote, quote, big rav, and they just go and they ask the rav, then I think it's less likely. But if they go to somebody who they have a personal connection with, I think the chances are better. I mean, my success has been better with those.
Mm-hmm. Parents that haven't listened and they've, God forbid, lost a child or child is maimed, whatever it is, do they wise up afterwards?
No.
Really?
Because it's min hashamayim.
Really? And
Yeah.
You've seen that?
Yeah.
Has there been one parent that's, but no, most of them are just like.
The truth is that I haven't spent a lot of time going into deep. I try to not address that issue. It's already too late, right? I mean, it's not too late for the next
You have
child.
other kids, yeah.
But for the person in front of me, for the child in front of me, it's already a done deal. So I don't delve into it deeply.
But even what you do see, I just find that so shocking, but yet makes sense. Like they say it's min hashamayim. I don't see Chazal signing up to that.
It's hard. It's really hard. But you see, there's different examples, like the person with the heart arrhythmia, who frequently will suffer as a result of the delay because he has to check with his Rav, because he has to do this, that, or the other. People suffer, and then they have a price to pay, and they almost always say, "Ba'az bin hashamayim."
That's why I think that there's a mistake, and people think that following halacha means that they're very religious. which I don't think is true. I think halacha is HaKadosh Baruch Hu's way, of God's way of giving us guidelines and boundaries for us to follow Him as a king, right? But they're not a means to an end. Underneath the halacha is an infinite amount of layers of wisdom and understanding of God's knowledge, which we're never going to completely get to. If you're focused on observing Yom Kippur because it's a law, and observing laws is what makes you incredibly frum. So if a doctor tells you that you have to eat or drink, you'll find like a conundrum because it feels like it's either God or this, right? However, if they're a deeply religious person, that like they understand Ratzon HaKadosh Baruch Hu and what the heart of the Torah is trying to tell them, Musar and Hashkafa, it's never a problem.
But I would hope that medicine and halacha are always in line with each other. Like there should never be a conflict.
They definitely used to, it's clear to me that Chazal were up on the latest of medical knowledge 2,000 years ago, or else they wasted a heck of a lot of time telling us about all these like weird, medical stories. They don't teach medicine in Chedarim now, right? But so back it was a major part. And yes, they were using leeches and a whole bunch of other things. That's because up on the latest 2,000 years ago. If Rabbi Akiva was alive today, I don't see him using leeches. Do you know what I mean?
No.
And it should be the same thing, just like Rabbi were up on the latest of technology. Just they don't have to use it, just to be aware of it, to understand the hashlachot, right? And medicine, the same thing, now.
So I remember when we were bringing computers into the emergency department at Shari Tzedek, and we brought the Rabbanim in to see exactly how it was working, and they were asking all different kinds of questions about how it's going to work and what's going to happen on Shabbat. For me, it was fascinating. And then at the end of the day, when they give their psak, that obviously, especially in the emergency department, it's all pikuach nefesh, and so
people that know me know I'm very against like internet for young kids, and I don't think most people should have smartphones unless they're married and professionals, and even with but at the same time, you need to know. You need to just have basic knowledge. You have to have basic medical knowledge, basic technological knowledge.
Or listen to the people who do when they come and advise you on A, B, and C.
Absolutely.
I don't really expect a lot of people to have a lot of knowledge about the disease process that they're suffering from. But when the doctor comes and explains it to you and says, this is what we think you should do, then you can say, okay, I want a second opinion. Maybe I don't need the surgery. Maybe I don't need this medicine. You go get a second opinion. The second doctor tells you the same thing. At some stage, you have to relent and you have to say, they really do know more than I do about this. It's just like coming and asking a Rav a shaila. You know the halacha much better than I do, and so I'm going to come and ask you a question, and I'm going to listen to what you tell me. If I go to a financial advisor, that's his job, that's what he learned, that's what he does. So he's going to tell me how to invest, or what not to do, and what yes to do. You have to find people and at some level trust them to say that they know more, they learned more than you did, they know more than you, and trust them when they answer your question.
So then I would say that there's two ways maybe to help that. Number one is, and you said this before, I do think at a younger stage, Rabbanim should be more pro praising doctors, and by the way, praising themselves, because also people can get too wise to listen to Rabbanim at certain points, which is a problem. But respecting teachers, respecting medical professionals, technological professionals. I think that as Rabbanim, we can start talking about that not at age 25, but at a younger age as well, to instill in kids there are people that you can trust, there are professionals that you can trust in general. That's number one. But number two, although this is looking for the future, but maybe there can be a role in a hospital that literally that person's job is, after a doctor has explained, okay, this is the treatment that person needs, then that person's job is to just have an open conversation with the patient. And if the patient wants to debate them, they can say, okay, there's this study, and we can go through it. And I know it sounds like a waste of time, but I really don't think it is, especially with difficult patients. Imagine if you had someone that's the role, is to just manage, these difficult cases and kind of slowly walk them towards the truth. I think it would be a great idea.
So it would be a little bit challenging to build a program like that, because then that person who comes after the doctor is going to have to know the medicine.
Yeah.
And they're going to need to be able to discuss it at the level of the patient.
Absolutely.
But with the knowledge of the disease process and the treatments and the workup and the testing that needs to be done. So that's a little bit more challenging. But one of the things that we did do at Shari Tzedek was that we have a group of volunteers who are more mature, and they've been in the system for a long period of time, and they know how the system works, and they walk around and they do talk to people. They can't talk to them about the medicine because they don't have the knowledge, but they talk to them about, okay, first of all, are you in pain? Did you get something for your pain? Did the doctor talk to you about your problem? Did he talk to you about what tests he wants to do, what medicines he wants to give you, what treatments he wants to give you? And they do it on their level, not on a medical level because they don't have the medical knowledge, but to try and interact with the patients, to try and see where the problems are going to be and try and nip it in the bud, if you will, and know that Ploni Almoni in room 10 isn't so sure that he needs the antibiotics for the large pneumonia that he has in his chest.
Yeah, but what if you created, I was implying more like an artificial intelligence. What if you were able to train an artificial intelligence model that was available at hospitals that people could access, to have that sort of discussion?
So
I think it'd be a great idea.
There are artificial intelligence programs just for medicine.
Really? I was unaware.
Excuse me 1 second. Open Evidence, it's called. And
have you used it?
Yeah,
Do you like it?
I just learned about it last week, actually.
Oh, really? Okay.
From my son-in-law, who's a medical student. But in the last week, I've had the opportunity to go in a couple times, and I've enjoyed it.
Really?
It saves a lot of time as far as searching the literature for different questions and different answers. It just summarizes everything right on the spot. Everybody always says that you have to be careful with AI because sometimes it makes things up, and sometimes
it'll absolutely lie to you. Yeah.
And you have to check the facts that you're being given. But on the big scheme of things, it's been much easier. Happened to me that I had this whole discussion with my son-in-law the day after I had a heated discussion with a director of a different department.
About what?
Well, then I can't tell you because then it'd be clear what's wrong.
Okay,
but,
that's fine.
No, actually not. The system at Shaare Zedek relies on the emergency department to do certain testing because it's easier and faster than having those same tests done upstairs in the wards. And we just don't have the staff to do it. We're just not keeping up with the EKGs and the x-rays. And so there's a lot of medical literature that talks about who needs that EKG in the emergency department before he goes up to the floor, before he goes up to the admission ward. Mm-hmm. And the directors of the different departments weren't so keen on the idea because it means that then they're going to have to devote resources to doing those tests. And so I was starting to look it up through the resources that I usually use. And if you don't word it exactly the way you want, you get something totally different. And so I was spending a little bit of time on it. And the next day I was sitting with my son-in-law and he said, "You're crazy, just use this." And we opened it up and literally 90 seconds later, I had a whole list of articles supporting my opinion.
That sounds amazing.
And then when I went back and I checked them, because everybody says you have to check and make sure it's not making things up, and they were real articles, and it was right on the money.
Well, what if we were able to just edit it a little bit to train it, knowing that it's going to talk to patients, right? I think like this thing, Open Evidence, if you're able to use that with a language model that know that it's talking to patients, make it a little bit simpler, and perhaps know that it needs to, I don't know, not lie and make stuff up. I think that'd be a fantastic resource for dealing with really difficult patients.
It's a startup. I'm with you. Let's do it.
Dr. Zalut, thank you so much for coming in today.
Oh, it was my pleasure. Thank you very much for inviting me.
Of course, I learned a lot.
Me too. Thank you.